cerebellar diseases or lesions. So we have seen the basic cerebellar connections and their functions in the last video. So the ataxia is a very common feature of any cerebellar lesion. Ataxia means abnormal rate, range, force and direction of motor execution, abnormal motor execution known as ataxia. So A means absence, axia means normal procedure, and otherwise known as irregular motor execution. So this is very common feature of any cerebellar lesion. So major causes of the cerebellar lesions are cerebellar damage or cerebellar disease. So one of the major reasons is the genetic related. So mainly spinocerebellar lesion, genetic related autosomal recessive disease, and neuronal damage and stroke. Stroke means the damage of the blood vessels to the cerebellar supply, and vitamin B12 deficiency or any immunological disease or antibodies against the cerebellar neurons, and thiamine deficiency, and very common is alcoholism and other non-common causes also causes damage of the cerebellum. So first and foremost, let's see the spinocerebellar damage or SCA, spinocerebellar ataxia. So in which we see the ataxia in all motor executions, mainly because the motor execution is maintained by the spinocerebellar lobe of the cerebellum. So coordination, abnormal coordination on the balance, one of the reason of one of the cause of the spinocerebellar lesion, and the drunken gait, so and dysmetria, overshooting or undershooting is known as dysmetria. So when we attempt any motor act, so we may overshoot or unable to reach the target. For example, picking up the glass from on table. The past pointing, so past pointing also one of the cause of or one of the manifestations of the spinocerebellum disease. And this diadochokinesia, inability to perform the rapid alternative motions or movements, dysarthria, abnormal speech, and mainly the abnormal syllabi in the words. Intention tremor, one of the common manifestation of the spinocerebellar disease. Intention tremor, when we perform any motor act, the tremor increases more than 8 hertz of contractions, especially during performance of any act rather resting. This is known as intentional tremor. And the second aspect is the damage to the vestibulocerebellar region, vestibular, which supplies to the vestibular nuclei. As usual, we see some coordination and balance disturbances like spinocerebellar lesion in this case, the ataxia, and mainly axial muscle and distal muscle involved in these manifestations, vestibulocerebellar damage manifestations, because this area is mainly dedicated to the balance and coordination of the body and eyes. So, and nystagmus, one of the clinical manifestation of the vestibulocerebellar lesion, because the nystagmus means abnormal motor or movement of the eyeballs without voluntary act. And VOR, vestibulo-ocular reflex, the reflex is which maintains the stable vision gaze on the object despite of head motion. So VOR also abnormal, and along with the nystagmus. And third aspect is damage to the cerebrocerebellar region, which causes the mainly the decomposition of the movement and the initiation, difficulty in the initiation of the motor plan or motor act. initiation of the motor act, because this area is the one which facilitates the final outcome of the motor plan, final execution or final execution part, which supplies to the or commands to the cerebrum. And decomposition means abnormal gross breaks in the any motor act. So motor activities may not be smooth in this decomposition. Ataxia may be seen in certain cases of cerebrocerebellar lesion also. The signs and symptoms of cerebellar lesion is purely the proportional to the extent of the damage that occurs in the cerebellum, or the extent of damage which extended to the different areas of the cerebellum. This is what the cerebellar diseases of different areas is seen in general. So thank you for watching.